6 months ago, I traveled to Cambodia as a part of my role with Save One Life, to check on our partners and to meet the beneficiaries of our various families. We take these trips every few years, and now that I'm a father, it's a lot harder to leave. I think about Carter at home and what I might be missing. Plus, the flights are incredibly long. I've seen Top Gun Maverick 3 times. Great flick. But when we arrived, it's clear why we came. These quote-unquote challenges are nothing compared to what the patients we visit go through. One family in particular stood out. We were visiting beneficiaries in a place called Siem Reap, driving past ancient temples and field after field of rice. The natural landscape was beautiful. But every minute we drove was another minute away from the nearest hospital. After over an hour, we pulled off the paved road onto a richly red dirt road, slippery and muddy from the rain, to meet Nak. He was waiting for us on a motorbike, one he borrowed from his neighbor. His family has no transportation of their own, besides a broken bicycle. We follow him, but another 15 minutes later, the road narrows to where cars can't pass. We must continue on foot. The narrow trail weaves between homes. Chickens run loose. Dogs bark at the strange newcomers that walk down the field. A child stops in their tracks and watches as we walk past. The fastest route to his house is currently flooded, so we follow Nak along a detour. His right leg was noticeably deformed. He could only walk on his tiptoe, but it didn't seem to bother him as he walked. Finally, we reached the small clearing where the family's home resides. It's a 15-foot by 15-foot wood structure. There were no windows or doors. One side of the house only has boards half of the way up. And that's where we met Nak's brother, Pak. His joints were even worse than his brother's. Their father isn't home. It's harvest season for rice, and he works loading the rice bags into trucks. He can earn about $60 a month loading rice during the harvest. Other months he loads sweet potatoes, but some months there's nothing. The mother works a small plot of land growing enough food for the family. The rest of the time is spent caring for her boys. The hospital is 2 hours away by motorbike and costs the family $20 each way. Almost their monthly income for one trip to town. What if they each have a bleed? Or multiple bleeds? The sponsorship from Save One Life is $35 per month. One trip to the hospital for each boy. But it's hard to think about what they would do without that support. Poverty compounds everything, and this problem isn't exclusive to low-income countries. So, how do we address it and combat these issues? My name is Chris Bombardier, and I'm a mountaineer with hemophilia. From 2011 to 2018, I successfully climbed the 7 summits, the tallest mountain on each of the 7 continents, which we covered extensively in season 1 of this podcast. But after we told our story, I couldn't help but feel that the story wasn't over. I visited a lot of different countries during my climbs, and learned a lot about what it means to have hemophilia both in the US and abroad. It was an eye-opening experience. So when that journey was over, I soon began my advocacy work with Save One Life to bring help, compassion, and resources to the bleeding disorder community around the world. And most importantly, learn from them about the challenges they face and what we can do to educate and help. That's what we're covering on season 2 of this podcast, breaking down the global climate around bleeding disorders and healthcare as a whole, examining what we can do to help countries dealing with poverty, inequality, and lack of access to life-saving services. But bigger than that, we want to answer a question that's much more complex than it seems. What is healthcare? Navigating treatment is full of its own peaks and valleys. And if there's anything I learned from climbing the 7 summits, it's that there's always another mountain to climb. This is the final summit, season 2, the world after the mountains.
This next segment is brought to you by Genentech. Being the caregiver of someone with hemophilia can be hard, but know that you are not alone. Genentech has several resources for navigating hemophilia, including stories from other members in the community. In words of Miranda, a mother with twin boys with hemophilia, Since connecting with other hemophilia families and educating ourselves, we made a point of getting involved with the larger community and attended conferences whenever we could. To hear more about Miranda and others in the hemophilia community, please visit www.thecommunityhelps.com.
This is Carlos Guzman.
My name is Carlos Alberto Fayron Guzman, and I always like to give my full name, and as a distinguished Latin America, we use two last names. My main role right now is an educator, and I wear several hats as an educator. So I mainly focus in global health education and planetary health education. So I work everything from the range of students, institutions, faculty, and large-scale policy change in education globally.
I think what's really interesting, when most people think about healthcare, just in the general population, they think about hospitals and medicine. But there are so many other aspects to good healthcare. What do you think makes quality healthcare in general?
One of the things that we need to start changing is our understanding of what we understand as healthcare, right? We usually, as you were saying, Chris, we usually think of healthcare as this patient-provider interaction that happens in a given place, that is the hospital. And when we expand, or the clinic, when we expand our definition of health to include well-being generally, not just of us, but of societies, communities, nations, but even beyond that, of our planet, our natural environment, our definition of health can really expand. And then you ask yourself again that question, what should healthcare be? And then you start adding other layers to that healthcare, that delivery of services in order to keep people healthy. And we step away then from this understanding of healthcare as something that battles disease and more towards a healthcare system that actually tries to keep us healthy.
One of the words that people might come across when they are kind of learning a little bit more about healthcare and healthcare systems is something called social determinants of health. Could you kind of explain what those are and how do they impact healthcare?
Sure. So when we speak of determinants of health, we need to imagine that health is the sum of a bunch of different processes happening at the same time. Your health right now depends on what you eat. It depends on the air you breathe. But it also depends on things like where you live. And not just talking about the context outside your doors, but also the policies that influence things like the type of education you receive, the type of labor you're able to access, the type of materials that they're using to build a house next door. All those little things are influenced by, at the top, policy. So when we think of health as a sum of all these things, and then also we can include things like genetics and the presence of virus. Is there good preventative services around? Am I vaccinated? But then again, peeling the layer back, what policies led to that vaccination? What elements of my educational experience led me to want to have that vaccine? So we start peeling back all those determinants, all those vector forces, and end up adding towards either a positive health outcome or a negative health outcome. So basically, these are factors, environmental and society, that influence our overall health and well-being. And they can range, as I was saying, everything from the actual healthcare system, the policies that support that healthcare system, to things like education, income level, employment status, and even, as I was saying, the neighborhood, the state, the country, the continent that we live in. And beyond just our biology or our genetics, the determinants of health framework includes all these things in order to understand how they impact health.
Let me just say it was extremely difficult to get care for Jose and others. My name is Maureen Miruka. I am based in Nairobi, Kenya. I'm a mother to Ethan, who's a 14-year-old with hemophilia. And what I do day to day is to work for Care USA, Food and Water Systems, a team. I'm a gender specialist, but my title is Director for Strategic Partnerships and Research.
With Jose, can you talk a little bit about what it felt like to have him finally diagnosed with hemophilia, and kind of what were some of the obstacles that you were facing with his diagnosis?
The fact that we lived in a rural area, so with a bleed, we had to get on a bus for 7 hours with a child bleeding, cross the country, then get into the hospital, do this test, and then have to go and come back again just to find out that diagnosis. I think what also made it difficult, coming from an area where malaria was endemic, and for me, I used to have malaria 4 times a year back in the day until I moved out of Kisii. There's no one else around you that has this condition that can even give advice on, like we would do malaria or other things on how to get tested. I actually met the next person with hemophilia when Jose was like 4 years old. And so just the access to information, we don't have as much as the internet and social media as we have now.
Yeah, just thinking about having to take a bus for 7 hours with a child that's bleeding, I can't imagine like the stress and the concern and the discomfort of that journey.
The other thing that there was no medicine, in the country. And so we, after after that 7 hour trip, or when I moved to another part, Nakuru, after another 2.5 hour trip, you had to get to Nairobi. Remember, I didn't live here. Request for friends to get their friends and relatives to come and donate blood at the hospital for them to make fresh frozen plasma, from it to be able to infuse him and then to go back. And I remember one of the times, the only factor that was available at Kenyatta National Hospital was expired. And I think it was always considerate of the hospital who were seeing then to say, we have to use this because it is what you have, but you have to sign this letter indemnifying us from the fact that you've allowed expired, treatment to be used on your son. So I think that's when my advocacy began in terms of saying, I'm okay to sign for it. We can put it here. It can be in his file and we can have that treatment. So up until Jose died, which was when he was 2 weeks, shy of his birthday, 6th birthday, and say we diagnosed him when he was around 9 months. So for those 5 years, that was our story. Go to hospital, get donations or expired factor, get friends to come and donate. So we began a drive, like just go to Gertrude's Hospital and say you are donating for Maureen. It will be in stock for next time we go because we know that we will need it. One time we were actually discharged from the hospital at 8 p.m. on one night, which is around now. We went all the way 2-3 hours down. The following day, back at 8 p.m., we were back with another bleed.
Wow.
You see? With factor, you don't quite have that. With those with FFB, it doesn't last that long in the blood. So that is what characterized management of hemophilia. And like I told you, I only met Salome, who had a child with hemophilia when Jose was, 4 years old.
Yeah.
So first of all, it was a very lonely experience. It was a very difficult experience.
And I think it's a good moment to bring up that all countries are limited by an amount of resources that they have, right? There is no such a thing as an infinite amount of resources. So countries always have to take that into consideration when making decisions where to invest. And the popular phrase would be their bang for buck, right? How do we have the highest degree of impact without spending everything that we have? Countries like Costa Rica have thought about this question a lot. And where we have found out where there is more, quote unquote, bang for buck is when we invest heavily in services that keep people healthy and preventing people from falling into disease. We call that prevention of disease and promotion of health approaches in public health.
It's really important to note too, like obviously our podcast is really focused on low and middle income countries, but that's not an exclusive indicator for better health outcome. I think actually the US is a really good example of spending a lot of money does not necessarily mean good health outcomes and have so many worse outcomes despite spending a lot of money.
What the healthcare system in the United States has done is not focus on prevention of disease and promotion of health, but focus on the other component of the healthcare system, which is treatment of disease. Now, when you think about the efficiency of those approaches, it is obviously much more expensive to treat disease because it needs doctors, nurses, tests, infrastructure, and a bunch of technology in the form of things like medications and others. And that increases the bill and also decreases the quality of life of an individual or societies. And that is very expensive. And the United States have a lot of resources, but the issue is that those resources and that high quality healthcare that treats disease in the United States is not reaching everyone because there's barriers towards access towards healthcare. And we can think of the simplest barrier that a lot of the listeners might relate to, which is your income level. Health expenses in the United States is the leading cause of bankruptcy. And that is the only country in the world where that happens. because of the way your health system is set up. Finance becomes a huge barrier to pay for healthcare systems. It's something of a privilege and not a right.
When I began my work at Save One Life, I knew I wanted to help all of those in need who I met during my climbs. People suffering from bleeding disorders all around the world. But I didn't know where to begin. The entire thing felt so daunting. What I quickly learned, however, was that meeting people where they are helps you take that first step. Coming from America, we have access to unimaginable wealth when you compare it to other nations. And by providing monthly sponsorships, only $35 a month, to families dealing with bleeding disorders, opens up their access to healthcare. In some nations, that $35 is the difference between 2 visits to the doctor a month, enough to stop a painful bleed and potentially even enough to save a life. It also lets families not worry about saving money from their job for a potential hospital visit, and instead lets them put those savings towards their future. An extra $35 a month isn't just $35. It's more freedom, and it's more access to life-saving care. Save One Life finds beneficiaries around the world who could be helped by these sponsorships. But we don't stop there. We work with them, talking with them through their troubles and concerns. We listen to them. And in a way, that's the most important thing I've learned from this work. The funds are necessary and valuable, but so is your time, and giving them your ear. Hearing where they are, and working with them to open up a path to a better future. That's how you begin the healing, even just a little.
So, Marie, your organization has been tied to Save One Life for over a decade, I believe.
That's such a story in itself in how it began, because initially it was, stipends to the families to enable them get to the hospital, meet other needs that come with having a child with hemophilia. Because I keep telling my colleagues, or my family, there is the issue of managing a normal child, but then there's a child with hemophilia, you have to go an extra mile. There's more trips to the hospital, there is this and that. And so it began at that point where we were providing that basic stipend to the families that really needed it after that screening process that you know well about, to moving to looking at scholarships for students that are needy and that either need to complete high school. Initially, we started with college, but now we have begun to do high school scholarships that will ensure that they make it through. And once they make it through high school, if they make it to the university or to college, they can do it. But if they don't, then what happens? Because they have missed school, then they're not going to be doing well in their exams and they don't qualify for university. And so they need to do the micro grants for them to do businesses. And that has gone well, so far so good for them to be able to earn a livelihood and be independent. The confidence that comes from earning your own salary, aside of being dependent on your parents when you've had this condition.
I think that's what our program is really about, is trying to support those families that already don't have a lot of resources to help go that extra mile. I mean, there's a huge gap when you're talking about just trying to get by with basic necessities and then adding that chronic disease on top of it. So have you seen how some of the families that have been in the program for a long time, because it's not just like for 1 year and then they move on, they can be in the sponsorship program receiving those stipends until they're 25 years old. How have you seen that kind of transform some of these families' lives, and what are the big takeaways for you from that specific program?
Oh my goodness. Yeah, last year is one of the times we did outreach, especially after COVID. And I have beautiful, amazing pictures from visiting a poultry program within the outskirts of Nairobi, because we have a cluster there. And this lady talking about what it has meant for her to have the extra income to take care of the needs of her son. His needs are so bad, so he needs to use a taxi to school almost on a daily basis, because they have to live in a day school, which is near their home, because he cannot do boarding, given his needs. And so her having that chicken project has enabled her to have the additional income. And the project is tailored towards ensuring she has housing for the chicken, and then getting the chicks themselves to grow, and then getting the food, because what we did is to pay for the food until the chicken feed, until she begins to break even and ensure that she can sustain the business. We are also trying to encourage them, say, don't come back to the society to say, I need another 2,000 to buy an extra machine. Make sure that your business can take care of itself and sort of run itself. One of my favorites is Simon. I say, like at my age, you find there's people who are like 10 years younger than me, or even 8 or 6, and they call me mom because of, of what, and not mom because I do it all alone, but because I'm the face of the society. He has run this posho mill. It is self-sustaining. He has married and had children, like Charles. Charles is even in politics. He did his electrical thing. He moved his family from the village to Nairobi. He has a wife and children, and they all look healthy, and they're just moving. So just looking at these boys, like when you look at the before and after. And I have a picture from Christmas, the last Christmas party we had before COVID, and I was like, look at you boys from where you've come from. There's some of them that were on crutches because of lack of the access to medicine, but now they have the medicine, and then they have the additional grants from Save One Life to help balance their lives. It gives me immense pride and satisfaction to see that. And I remember meeting with these two ladies again at this Christmas party, and they all had their leather jackets in maroon and in green. And one of them was wearing a short dress and said, you know what, now we can dress up. Because before we were like watchmen, going into the hospitals and nights and things like that. But now we can afford to dress up and then turn up in large part because we can have factor at home. Then we have additional income to take care of our children. And that's what I was saying. It's a whole package. You have medicine, you have income, you have livelihoods, you have the support, network from what we have to get that holistic picture. And as a social scientist, I look at those things, the things that are qualitative.
It includes all these other social factors that then influence our health outcomes. For the most, health professionals are being educated from a disease standpoint. That is, they're not really health professionals. They're actually disease professionals. And we need disease professionals. People will get sick. But the majority of health professionals need to understand that their role should be keeping people healthy and preventing people from going into disease. And when we shape that definition, right, when we are able to change that definition, imagine what we would make our healthcare system look like. It would not be hospitals. It would not be clinics. There would be hospitals and clinics, but all these other components would be included. So I say that I'm sort of on a mission to change how we understand health, to include all those social aspects, but as well all these environmental aspects that eventually end up having an impact over our health and well-being.
Around the world, poverty is one of the main determinants in access to quality healthcare. Save One Life's programs are designed to help combat the challenges that poverty brings to so many families affected by bleeding disorders in developing countries. A little support can go a long way. It can improve access to healthcare, education, and even food. But sometimes that support isn't enough. You can't put a Band-Aid on an internal bleed. So how can we come together to guarantee that access to healthcare is a human right? The first step is for you to be the consistent voice of change. Change can only begin when we all speak together. When we acknowledge our circumstances are completely out of our control, and oftentimes lead to a privilege that isn't shared by the vast majority of the planet. Grants and financial aid are the first step in combating poverty and access to care. But real change has to be structural. A paradigm shift, where we reimagine healthcare as more than just medicine, but as a holistic approach to ensure every person has the same access to care, no matter the circumstances. Next week, we'll visit Nepal to discuss societal pressures and how two brothers overcame their setbacks to create their own opportunities.
So that's why I started living in different way. I must accept this challenge.
I'm Chris Bombardier. Until next time, keep climbing your own mountain.
The Final Summit is produced by BloodStream Media. Learn more at bloodstreammedia.com. This episode is hosted by Chris Bombardier, written by Drew Johnson, edited by Greg Bernard, produced by Keith Corneluck. Executive produced by Patrick James Lynch. The final summit was also made possible by support from Genentech. Visit genentechhemophilia.com to take a look at how they are supporting the hemophilia community.